over the next few days, pending the amendment of the list and the swearing in of Dr. Gwen Ramohupa. With regard to disciplinary action against public servants, I have instructed the Director General in the Office of the Premier, sitting here next to me, Ms. Pidile Baleni, to urgently institute appropriate action to deal with the recommendation of the Ombuds with regard to this matter. Ladies and gentlemen, you would know that when you deal with public servants, this is regulated by the law, and we have to do everything in accordance with the law. And some of you would know that the law requires that before you suspend an official, you have to write them a letter as the executive authority, as giving them a right of reply why you should not suspend them. So with them, as opposed to politically appointed people, there is a very clear stipulation, and that so applies to other officials below the head of department. I appoint heads of departments in the province. So among the public servants against whom disciplinary action will be taken is the head of department, who is the accounting officer, and other senior officials who are identified in the report. I want to emphasize, as I also said about the political leadership, there can be no passing of the buck to junior officials, that I am not responsible as junior officials somewhere who made this disastrous and tragic situation that led to the death of our fellow citizens. I will make further pronouncements over the next 2 days once I have followed the law, as I have explained with regard to what's going to happen with the relevant officials in the department. With regard to an urgent matter about the NGOs, the Health Ombuds also recommends that the remaining NGOs that still have patients, we should, the Health Ombuds says within 45 days, but we are going to act much more urgently with regard to the situation of the patients in those NGOs, to ensure that they are placed in appropriate facilities where they will be taken care of. I've just discussing with family members. They have identified also the areas of urgency, which NGOs for them should require more urgent attention immediately. And we will work with members of the families, as they have a committee, and they have made it clear to us that they would like to work with the minister and I in implementing all these recommendations of the Health Ombuds. Dr. Gwen Ramohupa should be able to start as the MEC early next week. We're hoping at least by Monday. And she will work with the Minister of Health and myself in following up on all the recommendations with immediate effect. In conclusion, I would like to reiterate that I deeply regret and profusely apologize to the tragic loss of lives of our fellow citizens who were patients under the care of our Provincial Department of Health. Health is indeed about saving lives, and the circumstances under which these patients died are totally unacceptable. The action we are taking to implement the recommendations of the Health Ombuds will ensure that this situation never occur in the future. Once again, I convey my condolences to the bereaved family members, as I did during the meeting with them on the 15th of December and during the meeting with them before this media briefing. I would like to thank Professor Malekapuru Makhoba, the health ombuds, for his meticulous investigation and the report which points clearly to what needs to be done in effecting remedial action. We will implement everything that is in the report. Thank you.
Thank you, Premier. We'll now take questions. We will now take questions from the media. As the Premier said, he did speak to the members of the families. So we will only take questions from the media. And there are other processes that will be underway to consult with all the people who are concerned with this matter. So I really would like to appeal that only the media would now ask questions, and we don't hope to keep you much longer now. We'll take one question at a time. I think it's better that way. So I'll ask you to identify yourself and the media organization you represent, and then you can ask your question and try to make it short. So let's start there. Yes.
Good afternoon, Premier Anton Meyer from Pretoria FM. Did the former MEC, you've given an apology to the families and the victims, families of the victims. Did the former MEC offer an apology in a resignation letter? Do you know if she has apologized to the families or the victims, families of the victims? Thank you.
Okay. Premier, we can.
I just want to say the former MEC will release a public statement. So I think members of the media should await what she will be able to say to the people of our country and the people of our province, to the members of the affected families. So she will issue a public statement. We think now that the report is out. That's what she said to me when she sent me the letter. I don't want to speak on her behalf.
Okay, next question. Yeah. Okay, good. Sure.
Good day, Sipho Sterman from SABC TV News. I understand, Premier, that you...
We don't see you.
Oh, okay.
Oh,
Over
okay,
here.
sure.
I understand, Premier, you mentioned that she will be releasing a statement on the matter, but she reports to you. So did she give you any explanation on why was this matter handled the way it was? And certainly you speak to a lot of families. There's a lot of anger that she was very rude. She lacked empathy, and they couldn't just get across to her to air their frustration. Was there any explanation in terms of that behavior? Thank you.
Just wait, I think the Premier said Ms. Mahlangu has resigned, and he has accepted the resignation. Now, she doesn't report to him in that regard. The report was released today, but the Premier will make a will comment on that. Yeah, okay.
Okay, hi.
No, wait. Premier, we can just...
I think when the minister spoke this morning, he said that he spoke of distress and anger. As the Premier of the province, there are also things that I'm following up on. Quite clearly, there are also things that the issue of hiding exactly what the information was not only to the ombuds, but it was also to me. And that's why at every given point when we were following up to understand what is happening on this matter, the picture painted by the report by the ombuds, how many people are affected, which NGOs are ready, is the same game that was being played. And I am clear that there will be full consequences for all that. In some instances, it's some kind of fraudulent activity. Fraudulent activity, Minister, like issuing when you know that the NGOs didn't have valid licenses, and then overnight, once you know the report, this matter has been discovered, going around issuing, collecting the ones that were not valid, issuing fraudulent, signing at the hoof, last minute licenses. All those issues, everybody who played their role, as I said to you, including those who may not be in the report, our system of government will ensure that there are full consequences. When we say there will be full consequences, officials in our province precisely know what we mean. They may run to courts, but when we say there will be full consequences, there will be full consequences. That's what I want to assure the people of South Africa. So there are many things that may not be in the report that make me angry about why was this not disclosed by the officials to us, that this had to be found out by the health ombuds. And those issues will all be followed, and the processes that are in place will ensure that we act on that.
Okay.
The question about whether the MEC spoke to me, at this point, I want to emphasize that our approach to government in our province and as the Premier is that when an MEC, when something has happened in your department, I don't want an explanation that I was not involved. Mm-hmm. I don't want that excuse. It's worse if it is something that has to do with loss of life. I don't want an explanation that it is not me, it is somebody else, as I say. That I want every one of us to understand when we hold public office, when we are given the responsibility by our people to serve them, and something goes profoundly wrong, we have to face our people and take responsibility and take work from there. But if it's in a direct line of authority, for me, the key issue will be, what did you do to prevent it? And if things have happened, I really don't want to entertain a representation that may be made to somebody else that, but you know, I may have been misled too. It does not work like that. So if you are a political head, you are a political head. Something goes profoundly wrong, you must be the first to take responsibility. That's how I want to deal with that question of, I don't want to go into all the discussions I've had with the MEC. The first thing is why, I want to say to you, why did the department only know when Mr. Bloom, who is here, asked the question about mental health patients? That's the first number. And it is from there, after that question, and there's been several occasions of interacting with the department. I know the senior officials, I interacted it. What is the truth? What is the intervention? Why do we have to wait for the ombuds? Which NGOs did you say are ready and they were not ready? Which we now know, and get explanations. No, the NGOs, we have gone back, we have made sure everybody is cared for. The reports of the ombuds says that's not what the officials did. So there will be full consequences along the line. And I'm saying that goes beyond the number that's identified in the report. The people that I know may have said certain things in the meetings we had with the officials to get them to account. How many people have passed on? Why did they pass on? What happened with moving these patients? Why did you move them to places that are not ready? Because that's what this policy and the strategy talks about. Under what conditions do you de-institutionalize? So that's what makes me angry as well. And there will be appropriate action.
Okay.
Anger must not lead us to act outside the law, because people will win cases when in fact they did wrong things. It's my experience about disciplining people in the public service. People can win cases if you don't act properly.
Okay. Yeah. Oh, there's somebody with the mic there. We'll come to you.
Hi, it's Catherine from The Times. I just want to know, the MEC has resigned, but she was found responsible for this and 94 people died. Is anyone going to charge her criminally with negligence or leading to the deaths of these people?
Okay.
The Ombuds dealt with that matter, actually. There's set of clear recommendations about processes relating to criminal matters of charging people criminally. It's very clear in the Ombuds report.
Okay, next question.
I'm Pat Sidley from the British Medical Journal. Primarily, I'm asking a question of you, which is chucking back at you, the idea that everybody will be held accountable. So the question to you, Premier, is were you not yourself accountable in this matter? And do you intend resigning?
Okay. That's fine, Premier.
Well, I think, Pat, thank you very much. I've heard from you a long time ago. I'm glad that you are back reporting, but you are focusing on health issues. I am very clear, those of you who know me, if things had to do directly with me, I wouldn't even wait to be told to resign. That's if things had to do directly with me, if I was directly responsible, you wouldn't wait to hear about that. I would have resigned long before the report was completed, if this had to do directly with me. My responsibility is to make sure we hold everybody accountable in the system of government. We've been doing that. And our MECs know that if something goes wrong, and I want to emphasize profoundly wrong in your line of action, you will be held to account. I am accountable to the people of South Africa through the province, those who are in this province, and that's why working with the families, we have agreed that we will implement the report. Pat, the report is very, very clear about who must be held accountable. Let's stick to what the report says. If it said I didn't do what I was supposed to do as the Premier, I would have started with myself. The report is very, very clear.
All right, yeah. Where's the mic? Can we have the mic here, please? Sure.
Good day, everyone. My name is Johnny Sai. I'm with African News Agency. Just want to ask the Premier, please. You are interacting already with the families and they are very angry. But if some of them come so far with any demands for anything, compensation, closure, if there have been any demands made by the families or their representatives to Gauteng government or to the government of SA, anything? Thank you so much.
I think the families have appealed that we must deal with the loss of their loved ones with dignity. I would like us to appeal to that, because once they start putting demands, it sounds like they have appealed to me when I met them on the 15th of December, and then they said it today that we will have a process, myself and the minister, to work with them to find closure. Whatever finding closure for them will entail we are committed to work with them. And they are very committed. They said it to me just now, and the minister, we are very committed to work with you to find healing and closure. And their commitment must not be misunderstood as they want this or they don't want that. So the issues, that they will put them to us. They want us to work with them in a dignified way to ensure in the end there's closure. We mustn't put things they have not put on the table, but we will hear them, Johnny. We have agreed with the minister that we will have a meeting with the families as soon as we have both their representative and us have put together a team. That meeting must be preceded by processing of issues. That meeting will take place as soon as possible. Once there's agreement, they'll put the issues they want us to attend to. They said to me there are most urgent issues. And some of the most urgent issues is they appeal to me that it will be important that whoever you bring to take charge of the Department of Health must be someone who's qualified in health. And I reassured them, yes, I will make sure that I bring someone qualified in the area of health. They said to me, the remaining 4 NGOs where there are people must be a matter of urgency, that we should work with them to ensure that that's attended to. They also raised the issue of autopsies. That's a matter we will work with them on. The rest of the issues, they said they will work with us in line with what the recommendations are saying. It's too early to tell.
Okay, yeah. Let's get the mic.
Marika from Jacaranda FM. My question was partially asked there, but as you know, I mean, all of us, this is live, people are viewing this live, we're seeing the reactions as people are watching this. What promise and commitment can you give to people that still have family members in some of these institutions, in other institutions that the province oversees, and people in general that might seriously doubt the credibility and the power of our Department of Health in this country? Everyone is looking at you, so what's your response?
Okay. That's fine. I think we can. All right. The minister would like to comment.
Should we just move a little bit?
Well, I thought I made a lengthy statement in the press conference of the Umpas person. This is the Premier's press conference. I was just coming to observe, but he has asked me to respond to this question. I said we did an audit in 2010 by 5 different organizations about the issues of standards, including safety and security of patients, infection control, attitude of staff, after which we realized there's a gap. And that's why we launched the Office of Health Standard Compliance. And then as we are launching the office, we realized that there's another gap. Professionals are reported to Nursing Council, Health Professions Council, South African Pharmacy Council, but what about the institution? And we said, let's have an office of the health Umbat, which I said is a public protector of health. I'm sure you'll agree with me. It's for the first time in the history of the country that something like this has happened. We established that office to protect the integrity of health, to protect users of healthcare system. If you think the ombudsman did not do that today, then you may say so. We leave in the judgment to you. Has he not lived to expectations, as I said? Even in Parliament, there was a debate. Do you really need this office? What's going to be the role of the Health Professions Council? What will the Nursing Council do? I kept on saying we need a public protector of health to protect the public. And I believe from now onwards, a lot of people will know that there is such an office. And if something happened, there are repercussions. There are reports. It's not just a talk show. This morning I was asked on Morning Live whether we're really going to implement the recommendation. And I said, when I appointed that office, it was not a public relations exercise. It was a real thing. And that's how we are going to look at the healthcare system in the country. Thank you.
All right.
I just want to emphasize that we will implement every recommendation where I, as the Premier, has authority. That's the guarantee I would like to give.
Okay, I don't see any more hands. Oh, last one.
Sipho Sterman from SABC TV News again. Just one last question. What lessons are you taking from this whole episode? Especially when it regards, my colleague mentioned there that, the Gauteng Health Department has been tainted by this, because especially the families were going on about issues of lack of care. And that seems to have been an issue that if maybe this was attended to earlier with just one family inquiring about their family member, then maybe deaths would have been prevented. So just what are you taking out of this, and what are you ensuring that your health department takes individual cases seriously? Thank you.
Okay.
Well, we're basically taking everything out of this report. Even outside the area of mental health, where there are issues that patients and families go to our facilities to go and report. This report and this process is going to lead to a major relook, even in areas where sometimes issues don't reach directly even to me as the Premier. They take pretty long to get to where there must be political accountability. So we will overhaul, not just in mental health, and Minister, we will work together. The process that has already started of issuing annual reports that show the performance of the different institutions of our public health in whether they meet the national core standards, and the complaints system, the system of complaints we're going to overhaul. And I'm saying beyond the mental health issue that we are dealing with. So there's a lot of work to do.
Okay, that was the last, but I saw a hand here. Are you? All right. Yeah, let's allow you to be the last.
Zintle Maphumulo from the City Press. This question goes both to the Minister and the Premier. Under the leadership of MEC Qedani Mahlangu, we've seen a lot of bangles, from the security company tenders to the healthcare workers. Why was she kept so long in this position?
Let's deal with what we came here for. The report.
That question is not mine. I don't know why you say Minister of Finance. You know very well it's not mine. It belongs to the Premier. I don't hire MECs and I don't fire them. I wish I could be given such a power. I'm appealing to the Constitution to give me such a
Okay. Yeah, but as I said, the report, we dealt with things that are in the report. I don't think it would be fair to then list all sorts of other allegations which have not been tested. But the Premier can comment if he wishes to.
Yes, I am dealing with what has been the findings of a very important office in our country, the Health Ombuds. We are the first province, Minister, that this report deals with the health system in our province. As I said, we take everything that the Professor Makhura has raised. We will follow up on all these issues. The issues that he has raised, there's evidence there. He's not making allegations. And that's why I said at the very beginning to you, I will implement all these recommendations without delay and without reservation, because there's evidence he has provided. Any other thing outside evidence, I don't want to entertain. I want to deal with the evidence that has been provided here so that we find closure and healing for the families.
Okay. This brings us to the end, and as we said, we will keep you updated of any new developments as we implement the recommendations of the